What power of attorney rights do bone cancer patients have? Imagine facing a serious illness like bone cancer and wondering who will make important health decisions if you're unable to speak for yourself. That's where the legal concept of power of attorney comes into play. It's a vital tool that helps ensure your wishes are respected and your care is managed according to your preferences. A medical power of attorney is a legal document where you appoint someone you trust, called an agent or proxy, to make health decisions on your behalf if you cannot do so. This document only becomes active if a doctor determines you lack the capacity to make or communicate your medical choices. Until then, you retain full control over your health care decisions. As a bone cancer patient, you have the right to make all your medical choices as long as you are mentally capable. No one can override your wishes while you can communicate them. But if your illness or treatment causes cognitive or physical impairments, your designated agent steps in to ensure your preferences are followed. Your agent can decide on many aspects of your care, such as whether to admit or discharge you from a hospital or nursing home. They can choose treatments, medications, or procedures you should or should not have. They also have the authority to access your medical records, make decisions about life support measures like ventilators or feeding tubes, and handle organ donation or body disposition after death. Your agent is legally required to follow your instructions as closely as possible. If you haven't given specific directions, they will decide based on what they believe you would want, or, if unsure, in your best interest. To set this up, you need to complete a legal form while you are still mentally competent. It's best to do this early in your treatment journey because some treatments or complications could affect your decision-making ability. You can also specify limits on your agent's authority and include detailed instructions about your care preferences. It's important to discuss these choices with your agent, family, and healthcare team. Make sure to give copies of the document to your doctors, your agent, and trusted family members, and keep the original in a safe, accessible place. If you do not have a medical power of attorney and become unable to make decisions, the law in your state will usually assign decision-making authority to your spouse, adult children, or other relatives. However, this may not always match your personal wishes, which is why it's wise to proactively appoint an agent. For bone cancer patients, having a medical power of attorney provides peace of mind. It ensures your healthcare preferences are known and respected, even if you are temporarily or permanently unable to communicate. It also helps your loved ones avoid confusion or disagreements during stressful times. Remember, it's equally important to review and update your advance directives as your situation or preferences change. Open conversations with your healthcare team and family can help everyone stay aligned with your goals. It's also crucial to understand that a medical power of attorney only covers health care decisions. If you need someone to handle your finances, such as paying bills or managing insurance, you should establish a separate financial power of attorney. This document appoints a trusted person to manage your financial affairs but does not give them authority over medical decisions. In summary, as a bone cancer patient, you have the right to choose someone to make medical decisions for you if you cannot do so yourself. Setting up a medical power of attorney is a practical step that helps protect your wishes and provides clarity for your family and healthcare providers. It's best to do this early, discuss your preferences openly, and keep the document updated. Always consult with your healthcare provider or a legal professional to ensure your documents meet your state's requirements and truly reflected your wishes. Remember, laws and procedures can vary depending on where you live, so personalized legal advice is important. Your healthcare team can often help connect you with resources to assist with advanced care planning.